Hi friends, welcome to my channel. I know many of you find difficulty in the expression means when you want to give some explanation regarding something during your OET speaking session, it may find difficult. So I am here with some phrases how you can explain. For example, if you want to give some instruction regarding weight loss, how we can explain. I'm glad you asked about how to lose weight. It will certainly help your health and self esteem. Another way, there are basically two simple keys to lose weight. The first one is to eat less fattening foods. You should also be careful of your alcohol intake. The second key is to exercise regularly to raise your metabolism and burn extra calories. Do you think you can do that? You should always ask a question from their side. Then they might give answer. Sometimes they are reluctant to do this one because of their hectic life schedule or something like that, or may show some interest. Okay, we'll do like that. So we can give some advice to them that it will definitely help you to return your normal life, especially like disease condition hypertension. The weight loss is important. We can take some example like that. Okay, next move on. It's also very important to reduce high calorie foods. Foods such as peanut butter, nuts, soft drinks, cakes. Instead of these foods, aim to increase your intake of complex carbohydrates like grains and vegetables. Here what we are doing, we are providing some examples for them to avoid this type of foods to reduce your weight, and instead of that you can increase your intake of grains and vegetables, and also you can advise you can drink plenty of water and try to avoid sugary contained foods which will help you to reduce your weight. But in between we can tell them no need to be worried about your weight. We have several methods how we can reduce your weight and your approach. There is a different strategies we can follow. Like that we have to be empathize with them, and also we have to understand their concerns. We should always concern about their worries. Okay. Another tip what we can give, try to exercise regularly at least 3 times a week for 30 minutes. Can I suggest even taking the stairs instead of the elevator? This will all make a difference in your goal to lose weight. So, when we explain in detail, they may agree to do this properly and they are convinced. So, we have to explain in detail. The lifestyle modification will help them to avoid getting disease conditions such as hypertension, diabetes, etc. So take another example, high blood pressure. So how we can give suggestions or advice for them. Now let's talk about keeping your blood pressure under control. That is a signal marker. So they know we are going to discuss about the blood pressure. It is vital to have regular blood tests to check your cholesterol levels. Your doctor will record your blood pressure each time you visit. The most important thing you need to remember is to take all your medication as prescribed. It's also helpful to eat a healthy diet and to exercise for general good health. Do you think you can manage that? Should always encourage the patient to participate in the talk. Don't make a monologue. It can cause losing your mark. You will not be able to achieve 350 mark in your OET speaking. So in order to accomplish that, what you have to do? Always encourage the patient participate. So we can ask some open-ended questions or close-ended question in between. So if you ask some open-ended question, they will speak a lot. So in that way, you will get the participation. I think it's clear for you. I will come with another video later with other like pain management, kid smoking. So if you practice some of these phrases, it will help you a lot to give some explanation or advice during your role play. Okay.